In Lab 16, we are going to cover sensory anatomy. So some of these things we have talked about briefly before. For instance, we've talked about tactile receptors or mechanoreceptors with the skin system. So hopefully some of this will be review for you. In addition, we're going to cover some new structures with taste buds. We're going to look at the ear and spend a lot of time with the model and the histology. And then we will also cover vision and a little bit of olfaction. Vision, however, has its own separate lab because we're going to do an eye dissection. So that will be coming up in Lab 17. So speaking of that eye dissection, let's start thinking about bringing in those safety goggles. Safety goggles will be needed in order to complete the eye dissection because we want to make a barrier between your eye and the dissected material. Reading glasses are also acceptable. So if you just want to bring those in, make sure you have them on the whole time. If you have a goggle you've used for chem lab, that is totally acceptable, or just a regular old pair of safety glasses will be fine. But make sure you have those for Lab 17 because we will be doing an eye dissection. Additionally, you might want to think about bringing in a mask, mainly for the smell, but also as another barrier between the tissue and your face. I personally like N95s if you can get them, just because they help block out the smell a little better than a regular surgical mask. And we will also be wearing gloves. So make sure as you come in that day, you are gloving up. And just keep these things in mind as we approach that dissection. And a couple things before we jump into specific receptors. We have a lot of common terminology. So we're going to talk about various receptors today. The names for these receptors will all end with receptor or ceptor. So we'll have some sort of prefix referring to the region or the function of the receptor, and then we'll tack on ceptor or receptor. So just something to keep in mind. There are tons of receptors in the body that we just don't talk about in this class, but you might see some of them show up in physiology. We've got photoreceptors in the eyes. In the skin, we have mechano and thermoreceptors. The ones we talk about today will be mechanic related. So they're going to have that mechano prefix. We have proprioceptors. So we've talked a little bit about the motor unit with the motor neuron attaching to muscle fibers. That is going to help detect proprioception. Some of those stretch receptors we talked about, like the Golgi tendon organ, for example, they are all going to help with that sense of proprioception, awareness of our changes in tension in our joints as we move through space. We also have nociceptors. So if you write that over here, noci means pain. So these are our pain receptors. They're naked nerve endings in the skin. So we will not see those today, but just be aware that these other kinds of receptors exist throughout the body. First up, we are going to go back to our skin model, our integument. We have two receptors here that we have already learned about. So let's just review. This image is available in your modules. This is a labeled image of our skin system. And we're not going to worry about all these structures right now. I just want to point out our two receptors. Now it's important that you recognize these on this model, but I could also ask you this as a PowerPoint question. So you will be responsible for the model structures and then knowing the images from the modules. These are a little harder to pick up on a microscope, so don't worry about microscope questions for this system. But I do like to pull images from our modules or from the internet to show these things histologically. Okay, so superficially, we have a receptor for light touch. This should be review. This makes sense because the receptor itself is embedded more superficially, just under the epidermis. So to review, let's orient ourselves here. We have our epidermis, which is going to be this layer, separated from our underlying connective tissue, our dermis. And it is separated by this basement membrane. So this wavy pattern you see here, this should all be review, but keep that term in mind because we're going to see it again with some other sensory receptors in other parts of the body. So now that we've found our basement membrane, we want to look within these dermal papillae, these little finger-like projections into the epidermis, and tucked in some of them, we will see these yellow structures. These pod-like structures are our tactile receptors. Sometimes you'll see it referred to as corpuscle. So we've got tactile corpuscle or Meissner's corpuscle. This one does have two names. Both are accepted on the lab exam. And you can see that down here, nicely labeled for us. Our second receptor is a little deeper. And because these are sitting deep in the dermis, they're going to be responsible for deeper pressure and vibration reception. So they're picking up those deeper vibrations, sending some sensory information to our central nervous system as a receptor function. So those guys are going to be almost in the level of our hypodermis, this fatty layer that we see here made of those adipocytes. And what we have is this fingerprint-like receptor in yellow, and this is going to be our Pacinian or our lamellar corpuscle. If you want a memory cue to remember this, if we look closely here, the receptor does look like it has these concentric layers or lamellae. So you can use that term lamellar to help you remember this shape of corpuscle. But overall, these are going to be deeper within the hypodermis or just deep within the dermis itself.